The Healthcare Security Cast is sponsored by 3D Network Technology. Reliability is our core value. Visit www.3dnetworktechnology.com. And by Genetec, delivering security strategies for healthcare. Visit Genetec, that's GENETEC.com. And by the Change Execution Group. Visit 360lifetransformations.com.
Welcome to the Healthcare Security Cast, the podcast dedicated to healthcare security, safety, and emergency management. If you are involved with a healthcare security program or desire to be, this podcast is for you. Join the conversation as we discuss the issues that matter to healthcare security professionals while leveraging the expertise of healthcare security thought leaders and experts in personal development. And now, here's your host, Brian Hamilton.
Welcome to the Healthcare Security Cast. Today, I'm joined by Mark Schreiber. Mark, thanks for joining us today.
Thank you, Brian, and Happy New Year.
Happy New Year. Now, I always like to start off by learning about the person that we're speaking with, so I'll start off by asking, who is Mark Schreiber?
Thank you. I am a physical security engineer, technical consultant. I have my own firm that focuses on facility design. And essentially, I am the engineer geek for hire, if you will, for the security industry, because I've been doing this my whole career, helping protect the personnel and assets of a facility through the actual facility design. And so, I was very technically savvy and inclined, very much into technology, science fiction, those kinds of things, like, many were. And so I definitely, when I grew up, I wanted to be an engineer of some sort, but didn't necessarily have a specific passion on what type of engineering or technology application. And once I was introduced to the actual building design, construction, and specifically security applications within a building design, it just took away all of my interests and 100% focused on that, and pursued my career along those lines over 20 years ago.
Awesome. Now, I'm sure during that time, well, maybe you did start off wanting to be a geek for hire, as you put it, but if that wasn't your original goal, or even if it was, what was the process? How did you get to the point where you are now? Could you walk us through your career path and just kind of tell us how you got to where you are today?
Yeah, absolutely. So, in addition to the average person, messing with technology, applying technology as, a teenager, I did all of that everybody's aware of, from, actually building some of the, we'll say second generation of computers, home computers and PCs back in the day when everything had to be done with circuits and soldering and such, to the applications of those technologies. And so it was very clear for me to get into engineering and electrical engineering specifically. So, I went to college, university, and studied electrical engineering, but, didn't know specifically where my degree would be. And so I was recruited by Siemens Building Technologies, which is a very large physical security integrator and building integrator. And so started with them, learning about everything related to the building systems and design, and then just kind of adhered myself to security. Worked for them for 8 years, and I was recruited by a very large engineering construction company called Fluor Corporation, or Fluor Daniel is the older name people did, and being their security engineer, going around building large industrial facilities, all types of critical facilities across the globe, which gave me a great deal of education, not just on base physical security technologies, but how actual, large facilities are designed and constructed in very difficult scenarios, very complex environments, sometimes very costly, and, governmental security level of criticality to some, just let's process a manufacturing facility very quickly. So learned a great deal from that. And after being with them for 7 years, decided to start my own independent firm. It's a boutique security engineering firm, so that I could help organizations with everything related to physical security engineering, not just, let's get it built and get it out there, but how can we make it more nuanced? So that, brings us to today, where we just provide that service for all kinds of organizations, hospitals, healthcare environments, labs, pharmaceutical facilities, around North America, and even some overseas clients when the special need arises.
Excellent. Now, when I had the privilege of first meeting you, it was at the IAHSS ACNE. I believe it was the 50th anniversary, and I had the pleasure of introducing your presentation, which was related to Septet. Now, our conversation today is going to focus a great deal on Septet. But before we jump into that, I just want to get your thoughts on being a volunteer. I know you're actively involved with both IAHSS and ASIS, and you're kind of the guy that people look to for physical security things, especially when it comes to Septet and drones, for example. So if you could just share your insights on being involved.
Well, thank you. Yes, I wouldn't sound necessarily the only person that people go to for physical security design, but I definitely try to assist all of the organizations with that methodology, because there's definitely a significant education curve for most security managers on understanding what can be done with physical security design and what's the proper process in designing construction and planning for it is where we see the biggest gap. So definitely have found that investing in ASIS International, investing in IHSS, as well as InfraGard and other organizations is really worthwhile, just to make sure that people are utilizing all the resources that are available out there. Because if one organization doesn't know that this information is available from a peer, we don't want to reinvent the wheel per se. And I started doing support for ASIS initially as my first industry organization, was actually to support and give back from what I received from mentors and other peers in the industry. Because once I was actively involved, I realized how many resources and lessons learned were available through that connection. And so I was just basically drinking from the fire hose as an engineer, learning about security operations and risk management and what the proper methodologies and what the challenges, how does it fit within the overall business and enterprises. And that was a great deal of education that I couldn't learn at college, or didn't learn at college or couldn't learn at college. And so I learned a great deal from that. And basically, once opportunities allowed me to provide information, provide feedback, I wanted to return that favor. And that's led me to today, where I've filled many different volunteer roles within ASIS, supported IHSS, with different educational initiatives, supported InfraGard and many other organizations when it comes to physical security design and technology applications. So to kind of circle back to your main question, it's just, I think, the right thing to do. I think it's the appropriate thing to do, because really it takes all of us to work together to protect our facilities, to protect, the personnel and people, whether it's in a private enterprise or in the public space. It takes everybody working together. And so I think it's very appropriate and useful.
Awesome. Now let's jump into the conversation about Septet. For the purposes of this conversation, let's start with the 3Ds. What are some of the common applications you've seen in healthcare facilities? Now, I know there are a lot of different takes on this. When I did my Septet course, we learned the 3Ds. So I just want to kind of get your thoughts on that. And, if you want to elaborate, I'd appreciate that.
Absolutely. So within Septet, the 3Ds terminology, which some may confuse with the general facility design 5Ds, within Septet, the 3Ds are designated purpose, definitions of behavior, and designed facility to support those behaviors. This shouldn't be confused with the 5Ds of traditional security, which is deter, detect, deny, delay, defend. So within Septet, they just use those applications specifically to understand what can we actually affect within our built environment, that is within our buildings, our facilities, our spaces, whether there is something there or there's not something there, there's absence, that all has an impact on human behavior, which is a foundational principle of Septet. So the designated purpose, the first D, is really trying to identify, okay, is the facility itself designed in its essence to serve a specific purpose? So is it designated for a healthcare facility? Is it designated for a specific hospital? More importantly, is it designated for a trauma hospital, ER space? How is that specifically designated, and make sure it serves that purpose? Because once you start to, focus the value of that facility on that designated purpose, it allows you to do more within that space to protect the individuals within that. The second D is definitions of behavior, not just definitions of the space, but what is the allowed or accepted behavior for that facility. So if you think to it, we go to different buildings, there is expected behavior within those different buildings. How we approach the airport and go through security screening, that definition of what's normal and appropriate behavior has changed over the time. And so there has to be an effort within the facility design and the mechanisms of how we expect those behavior is itself supported. And that's done not just with the actual building design and how we organize and funnel people to different spaces, but how we actually communicate the expected behavior. That's through signage, through communications, through measures and such. And so that's where that second D comes into place, not just, the facility itself. And then the last is, the most critical is design of the facility to support and control those behaviors. So not just does the facility overall have a means to be a hospital, but how do we actually design the nuances of that facility so that we can support hospital operations as well as hospital security operations. And that's where we come into a lot of the common principles that people are more familiar with, which is controlling access into the building through natural access control, which is the entrances, what are the exits that we don't want brave people to come to, territoriality, the means of actually being able to support natural surveillance within those. And so we go through designing those facilities so everything is optimized within the hospital, not on the exterior, not on the perimeter, but also on the interiors of the facility. So visitors go through their proper screening process, proper check-in processes, and then they are segmented, controlled throughout the facility as appropriate versus staff versus, your vendors and deliveries and so on and so forth. And so we want to look at designing the facility overall to support those behaviors, but also control those behaviors. So someone who is, meaning ill intent can only get so far through the building before they're observed, before they're, responded to and addressed.
Excellent. Appreciate that explanation. Now, for someone who has no prior knowledge of Septet, and actually, I guess for someone who has no prior knowledge, I should have been mentioning Septet is crime prevention through environmental design. So if you didn't know that, there you go. Now you know. I wanted to take a bit of a deeper dive into the 5Ds as well. Would you mind talking about those concepts a little bit, just for anybody who, like I said, this may be new to them?
Yeah, absolutely. The 5Ds is a very common traditional security measure. So most people who've gone through introductory security applications have heard these, whether military, law enforcement, traditional security operations management backgrounds, but that's deter, detect, deny, delay, defend. And so that comes into the overall arching capabilities of a security organization, which is first off, we want to deter. We want to make sure that people understand that this space is protected and we want them to go somewhere else if they intend to do crime. If they still intend to do crime on our property, we want to then be able to detect, that unauthorized behavior. Once we've detected it, we then want to be able to deny them access, deny them capabilities, deny them the full measure of their skills or opportunities. And that's, through force protection, that's through the hardening of the facilities, direct response, et cetera. The next one is delay. And that is, well, okay, maybe we know we can detect them and they're going to get into the facility. How do we delay them from getting to our assets, our people, our materials, whatever it is that we're actually protecting? And then the last is defend. If you're from the military background, they would say destroy. And that's essentially how do we then apprehend, how do we prevent, block, stop, whatever the methodology is of that individual or team of individuals from getting to our assets. Very high level concept, and it can be done in many different ways, many methodologies, but it understands the main focus on those 5Ds is it's a continuum of the threat getting to the asset and understanding that you have these measures, these means along the way to ultimately prevent them from getting to, your personnel, from getting to your asset beforehand, and a critical understanding of that if we get into the scientific measurement of this is time. The more we can expand time, whether through deterrence, detection, deny, delay, or defend, the more likely that we're going to stop the threat or prevent the threat from, having the most impact on the environment. And what's great about that is, in that macro sense, is this can be applied everywhere, any facility, any type of, protection organization, whether it's law enforcement, whether it's military, whether it's private security, public organization security, individual security, personal security, et cetera. All common principles within that. But again, different than the 3Ds, which came from a different design aspect within Septet. And then just a general note, Septet has been around for many years, decades now. Originally started basically in the 60s and 70s, but it didn't really become kind of commonly known or popular within professional security industry until about the late 80s and 90s to today. So it's still, a lot of people haven't gone through Septet training. A lot of people aren't familiar with the fundamentals, and definitely very few people have really implemented all of the Septet tools that are available to them, whether in a healthcare environment or otherwise.
Oh, absolutely. Now, in terms of some of the fundamental concepts, would you mind talking to us about natural surveillance, what it is, and some of the best practices or effective applications that you've seen in the healthcare setting?
Yes, absolutely. So natural surveillance, which is one of the fundamental and most commonly used Septet principle, is understanding, just like with security cameras, which is electronic surveillance, that humans have the ability to survey their area, and they actually do a much better job of doing that than just the standard camera does. In fact, as we talk about the application advancement of technology within video surveillance, and we're trying to embrace artificial intelligence through machine learning, deep learning, we'll avoid the technology differentiators there. We're actually trying to have the camera mimic what a human can do. So natural surveillance within Septet, which is, again, has been around for decades, is trying to say, how do we utilize the capability of the human to observe their space and utilize that to alert a response, right? To initiate a response, or if they are a security personnel, to enact the response because of that natural surveillance. And what was clearly identified is a bad facility design, a bad building, a bad, city design actually can prohibit someone from being aware of what's going on because they can't see what's actually taking place. We use the common section, see something, say something. Well, if we can't see something, we can't therefore say something. And so natural surveillance is trying to maximize the visibility of not just security personnel, but all occupants of a space of what's going on in their surroundings. Now, within healthcare environments, we most commonly see this applied well in your main reception areas and your main corridors and nurses stations and such, where someone is going to be stationed in one specific location, but they can see in multiple directions, down hallways, through windows, et cetera, et cetera. So we like that natural surveillance. That's a really good use of that within the hospital environment. Where we see some room for improvement is those areas in between, where we've got these quiet corridors, we've got these walls and doors, in this labyrinth where you don't see what's going around the corner and you don't see what's happening in this dogleg section, because, as we all know, hospitals keep getting built on and added on and added on. And so the original design doesn't necessarily flow and keep those same principles together. So whenever we have the ability to affect that, we're trying to maximize the view of staff and all personnel in every location. Another really good use, and there's always a trade-off with this, is the use of windows. And so an example is, everybody's familiar with kind of those open air atriums where there's windows and everybody can see what's going on outside of the hospital. That's really good, because if you're security personnel or anybody and you see a threat approaching, right? A fight happening outside, a vehicle running into, a pillar or some, planter or something like that, your response to that is going to be very quick, versus if it happens outside of a brick wall, you won't necessarily know what's happening. And so the time to respond, to act, is slower. Well, we can expand that if we look interior areas and actually having interior windows, visible partitions, and other types of design solutions, so people are aware of not just what's in their space, but in spaces that are adjacent to them, spaces that are in, such as, courtyards for patients, lounge spaces and such. Those don't necessarily need to be isolated areas where something could happen in them and no one knows until someone hits, an emergency button or picks up the phone. We want that to be able to be observed by as many people as possible. So it's looking at what people are able to see within their normal daily routine as they move through their environment and maximize that, supporting that with, traditional communication.
Excellent. Now, a couple of things that you spoke about there from the technological side of things were video surveillance and artificial intelligence. Now, from your perspective, is there anything in any evolutions in those areas that are of interest to you specifically, or just where do you think you'll see these technologies going in the years to come?
Great question, and I'll try and unpack that as quickly as I can, because in itself it's a whole podcast. I would say, in essence, it's extremely exciting about what we as security professionals will be able to do in the future regarding the applications of artificial intelligence. And where it really comes down to, as the return on any investment is about, actually magnifying your capabilities of your staff. So think of force multiplier in the truest sense of that term, and being able to let that technology do things that we would normally expect or depend a human to do. Now, one person could do that very quickly, or do the work of two people, theoretically, once that gets fully developed. But what we're seeing right now is, just like any new technology, it's going to start off being very clunky, very difficult to implement, very limiting in its applications. But over time, it will start to advance. And what you have to be very aware of with artificial intelligence, whether it's with video surveillance, which is the most common application of that, or even access control, other technologies as we apply that, is we have to be very careful about the legal, societal impacts of implementing that, as many, teams have already realized in trying to implement that within public spaces, is you make sure you have to have a very clear agreement. All privacy factors are addressed. All legal factors, which aren't necessarily just privacy, are also addressed internally and externally through agreements, MOUs, et cetera, as well as proper signage to communicate that. And then you learn through that technology. And the great thing that AI promises is it will itself evolve. So it will just keep getting better and better and better and better. One thing I will add to that is AI is not new. We have been using AI in other areas. We actually even use AI in the most simple sense within traditional security systems, in the fact that we can run report, we can actually, manage the system itself in a more intuitive manner than we might have to otherwise. But it's just going to rapidly advance to the point where, if you think about today, the use of audio recognition, such as through Siri or Google, that kind of capability within your physical security systems, once that's fully implemented, would be great. To the point, let's fast forward. You're saying, hello, access control system, tell me the last time that Brian went through this door, using this type of application, and it will immediately answer you. You don't have to type in a key. You don't have to answer a report. That kind of artificial intelligence is the future, but it's not here today. It will take time for us to get to that level of usefulness.
Excellent. Now, segueing into access control and just looking at natural access control, what are some of the effective use cases you've seen in the healthcare environment? And could you talk about that concept a little bit more as well?
Absolutely, and it's a good point to clarify. Electronic access control, your access control systems, which lock your doors, unlock your doors using a card, physical card, badge, mobile phone, or biometrics, is different than the Septet concept of natural access control. Again, natural means that we're trying to take advantage of human behavior. And so Septet natural access control is talking about, okay, if I'm someone who has never been to this hospital, this healthcare facility before, what would be a common behavior activity? Okay, what would be my perceived front entrance, my perceived visitor entrance to come into that facility. If that's not designed well, we'll have people walking around trying to get into staff doors, exit doors, delivery areas, and things like that. So there's this common sense application that, okay, natural access control supports funneling people to the proper entrances and getting them into the building. It doesn't stop at the entrances. It's all throughout the facility. So if you think, I'm a visitor, how do I want to be routed through the hospital or other type of healthcare environment? Natural access control is maximizing the design of the facility. So it's very obvious, it's very clear where we go through. And in security, we really like that, not just because we don't have to manage people wandering around our facilities. We also know exactly where we're going to monitor and screen those personnel as they go through the facility, not just the initial screening points, but throughout the whole environment. So as you think, wherever you're going to be setting up your, security reception areas, your checkpoints, your screening points, all of the, even the physical access, electronic access control and physical access control throughout the facility, that's what we want to design in the building itself, in the walls, the doors, the hallways, throughout that whole facility. And that's where we apply Septet as a partnership with the architect, the actual design of the facility. And then the other options are that we're trying to identify if someone is wandering around our facility, they've clearly bypassed the main entrance or entrances, and they're going around and looking at exit doors and holding on, tugging on doors. That's clearly unauthorized behavior. It's not someone's confused, it's someone who is intentionally trying to get into the facility if not through the main entrances. And so it allows us to use our resources much more effectively and be able to then immediately address that person and respond accordingly.
Excellent. Now, I want to transition to the other point there of electronic access control. Where do you see that technology going, and how do you see it tying in as well?
Absolutely. So I think the biggest change with access control over the past, we'll say 10, 20 years, is not just that we have technology that works on any type of portal. The way I use that term generally, because it's not just doors. It could be, roll-up doors, swing doors. It could be, it could be delivery entrances and things like that. Anytime we're trying to control any type of product or person coming in the facility, that has greatly expanded, and we have capabilities to provide electronic access control on any portal. There's been very few applications I've found where I can't apply access control. But what's really been useful of most recent is now we can actually monitor, interface, and control those on a mobile platform. And I use that to mean it can be on a laptop that's connected to the local network, whether it's Wi-Fi or wired. It could be on your smartphone that your security personnel are using. And so you don't have to rely on a single command center, security command center, general command center, emergency center, SOC, whatever terminology you use, to actually see the issue, see the alarm, call someone, then to respond. The actual process for something unauthorized to happen and initiate a response can go directly to the closest person who can respond. So again, when we talk about how do we maximize the time to delay a threat or minimize the time to respond, that is a big factor that access control is now capable of doing. So supporting those mobile platforms. We also see a benefit now where we can apply higher level of access control capabilities to hospitals and other types of general environments versus just your high security military facilities. So the application of using multi-factor authentication, which means I'm not using just a badge, I'm using a badge and a PIN code, or a badge and a biometric, tied together, a badge and a phone, right? Where you have to have two items to verify your identity, can now be applied in a much, much less expensive cost than it used to be on all of our high security areas. And so that allows us to really lock down those critical areas, critical asset areas and such, where versus relying on a proximity card that can be duplicated with a $20 device. So anybody who has some level of technology awareness and access to an employee might be able to, duplicate a badge pretty easily. We now can subvert that with better technology that's allowed us to support access control.
Excellent. Now, the next principle I want to talk about is territoriality. I guess I'll ask if you can explain the concept a little bit, and also how you've seen it effectively leveraged in the healthcare environment.
Yeah, absolutely. So the CPTED principle, again, this is specific to CPTED of territoriality, is again another common sense kind of application when you really think about it. But the problem is we see this commonly in hospitals and healthcare environments as not being fully implemented. And that is, are you clearly identifying what is the healthcare's property, the territory of that property, and what are the expected applications and behaviors of that location? So, for example, we see this very often is healthcare environment will own a very large piece of property, but until you actually get up to the building, you had no idea who owns that property. And so you can think of unauthorized behavior such as loiterings, sleeping, other types of activities are occurring on this private property. And when that person is addressed, they're like, well, I didn't know. They can claim, I don't know that this property, is owned by the hospital, et cetera, et cetera, et cetera. And so what we want to do is provide very clear boundaries of the private property versus the public space, the public sidewalks, et cetera, and then signage to identify clearly the expected behaviors of that. Territoriality then goes further is to understand, okay, now when someone is coming into the healthcare environment, hospital, here is the space where as a visitor, I'm expected to come through, and I've got clear signage communicating to me, visitors entering this way, visitors are allowed to do this. We can talk about, screening rules, weapons prohibited, et cetera, identifying that as someone comes into the space versus other areas of the hospital, such as no unauthorized personnel, making it very clear that, as staff, that this is their clear staff entrance, and this is the staff procedures to come into this environment. And we do that even in nuanced ways, such as not just clear partitions or clear barriers, but things such as different types of sidewalks and pavers to clearly identify this is the path that someone should go through. Once they cross out of this is no longer their space. It has the most impact on the outdoor public area, but we can actually use it even further on interior areas where we're identifying, okay, we're going down this hallway, which might give us some natural access control because all the visitors are following the green path, we'll say, down through the hallway. But once they get to the staff door and staff entrance, now everything changes color, it changes scheme, it changes look and feel, and it just gives that person that visible environment of like, okay, wait a second, am I supposed to go here? And gives them the ability to check themselves before they go and perform an unauthorized activity. And that's extremely important within the healthcare environment. I'll say people who aren't thoughtful about working within a healthcare environment, a lot of the patrons are in a stress condition, right? So we have to not assume that they're going to be situationally aware, that they're going to be thinking about what's going on. They're very internally focused, so we have to basically scream at them to say, look, this is proper behavior, this is improper behavior. Please follow our requests, so we don't have to respond accordingly.
I think that segues well to the next question I have for you, which is for a frontline officer who's listening right now, who's part of a healthcare security or public safety department, what actions can they take to support CPTED in their environment?
Sure, absolutely. And so first off, from a frontline officer, you have to understand, like, there's only so much that you're going to be able to impact. But if you are knowledgeable, right, and you can identify those little wins, those simple things that can be altered to benefit, it's going to help everyone and it's going to show your initiative. So I'll say, first off, just get some base CPTED education. There's many ways to get, a good introduction to CPTED at a very low cost or no cost type of environment, whether through IAHSS or ASIS, and other initiatives, on just understanding the concepts first. You don't have to go through advanced training initially. Get, your proper support from your leadership but just get a basic understanding and then start to look at your environment. Look at what is actually helping versus what is hindering your environment. And a lot of people, especially in our profession, try to focus on kind of the negative, right? But also give appreciation for the positive. Because if you see something positive, someone in your environment has actually recognized that and done something to make that happen. So just recognizing the positives is actually a good thing to communicate to staff, whether it's your peers who made that decision, your leadership that made decisions, someone within administration made that decision. Just show that appreciation. Say, I really like whoever designed this entrance to the hospital because from my position, I have really good natural surveillance of not only who's coming through the doors, but as they approach the doors, right? Understanding that concept too. Natural surveillance is a very beneficial item for frontline personnel. For example, what we always like to communicate is I ideally want anyone who's in a reception area to not only see everything going up to the perimeter door, everything approaching the perimeter door, and all of the outdoor areas surrounding that area. That way they can monitor what's going on in the parking lots. That way they can monitor what's coming in the, the pull-up entrances before they get to the door, because we want to stop the threat outside the building as much as possible. So look in that area and say, okay, where can I really see what's going on through my natural surveillance versus where I can't? And if you see something like, okay, there's a planter blocking a window that is really like blocking a view, then that's something that a frontline officer may be able to make a request. Is it possible we can move that planter to the left a couple feet, to the right a couple feet, and allow me to have that maximum view? That's something that might be in that other environment. Another one, and I mentioned this earlier, is signage, right? Do we have clear signage expressing the behavior? And that comes into the territoriality, communicating to them what is the expected behavior. So if your job is to stop people and screen them for weapons, screen them for, other types of measures beforehand, are we sure that there's signage that communicate, the average person coming off the street, what is going to be screened before they come in the building? Because if they are carrying a weapon, we don't want them coming in the building. We want them to turn around, go back to their vehicle, go somewhere else before they come into the facility. So making sure you see that is well communicated through the territoriality of the environment itself. And then natural access control, the other third main effort there is understanding, that we're actually trying to direct them through the right path. So if you see something that's actually directing people or confusing people to go to a different entrance, ask about that. Say, is there something we can do? Most likely it won't be within your purview to actually make that change. But if you just ask that question, you may spur the conversation that goes to the person who does have the authority to make that change. There's a fourth principle, common principle that we didn't talk about, is maintenance. And that one, frontline personnel really have a big impact on maintenance. And I'll jump into that one really quickly, even though you haven't asked, Brian. But maintenance really comes down to that visual impact of, is someone actually taking care of the space? Is someone actually owning that space? And that's shown through good maintenance versus poor maintenance. So one that most security professionals know is graffiti. Right? If someone were to actually provide graffiti on your facility, the rule is get that addressed quickly, right? Because if that graffiti sits there for days, for weeks, it communicates, to everyone, anybody who comes by, that this facility is neglected, which then means invites crime. So think about that perspective within your whole environment. If there's trash lying around, if someone doesn't care, doesn't pick up, doesn't, show a clean environment, it's not just an exemplification of the staff, it communicates the whole organization. And so we want that environment to be spotless. And frontline personnel are going to be the first people to notice when something isn't being properly maintained. And it's not, bull in a china shop, go say, why isn't this being picked up? It's recognize it and do what you can to address it. Pick it up yourself if it's something like simple trash, get rid of it. If it's something that you don't have the ability to do or authority to do, then look at what's the proper way to communicate that this should be addressed and how you can support that being addressed as quickly as possible.
Awesome. And I think a great way to summarize that, Mark, as well, is the broken window theory. Would you mind talking about that a little bit as well,
Exactly.
for anyone who's never heard of it?
Yeah, absolutely. The broken window theory, and it's been well, publicized, and it's very, very well known in many of the architectural circles, as well as obviously professional security. But the principle, comes back from, I want to say it's the 50s, and I could be wrong on that. But essentially, if there's a house sitting in a neighborhood and someone throws a rock and breaks that window, that first day, people are going to recognize that window's been broken, and they're going to be like, oh, that's an indication of crime, possibly, or, possibly a dangerous neighborhood. But if it's only for one day and then it gets repaired, then people are going to think, okay, well, it may have been some kid who hit a baseball, right? Things like that happen. But on day 2, day 3, day 4, day 5, if that broken window is still there, that really resonates and communicates that, okay, that building is neglected, that house is neglected. And then if you start seeing more broken windows, that really communicates that this is an area of high crime. Even though there might be legitimate reasons for that, there might be a reason for it. It might be, my house, and I was on vacation for 4 days, and none of my neighbors told me that someone broke, 2 windows in my house, that kids were coming by with a, BB gun or something. If it goes on for a while, it really just communicates, a neglect, which invites more crime, as well as danger. And so we don't want our facilities to communicate danger, absolutely, but we also don't want to invite crime. So any type of visible indicator of unauthorized behavior, we want to address that and get rid of it as quickly as possible.
Right, and just to add to that, I know there was, and I'm going to butcher I'm not going to try to take a stab at the time frames or the location, but I know there was a bit of a social experiment done where the windows of a car were broken and it was left to really track the responses to it. And eventually over time, I want to say it was within a week or a couple of weeks, the car just was people just really started doing more damage to it, breaking the rest of the windows out. And it really just supports what you're saying here.
Exactly. And that's the thing that where Septet really kind of expands the capability of a security designer is it's not just about technology, and it's not about just your generic environment. It's about understanding how we can influence human behavior, right? And there's pros and cons to it, right? There's unintended consequences as well as intentional benefits. And one little kind of item I like to reference is there was this great little experiment done, and it was purely for a TV show, but it was dealing with crime and how people perceive. And I won't remember the TV show offhand, but basically someone went to a very large, busy urban environment, and they said, okay, I've got this wallet here. If I just drop this wallet on the ground, how long do you think it'll take before someone picks it up and tries to take the money and get away with it, right? And people are saying seconds, minutes, or whatever. And they said, well, how about if we do this? And they laid the wallet on the ground, and they used a white chalk, and they outlined a square around the wallet. And then they stepped away, and no one for like an hour would pick up that wallet. Now, the only thing that changed in that condition was that there was a clear outline, a marker indicating that someone had intentionally put that wallet there, right? And that totally changed how humans behave because of that. And so within Septet, that's just a little ad hoc example, but in Septet, that's what we're trying to do. We're trying to make sure we're very thoughtful, we're intentional about the design, the use of our facilities. So the bad elements clearly understand that it's being taken care of, it's being watched, monitored and supported, and they're not going to get away with crime easily within that environment versus others.
Excellent. Now, we've covered a lot here. Is there anything that I haven't asked you about yet that you'd like to discuss?
Not particularly. I'll just add that, Septet just expands your capabilities. As I say, it's additional arrows in your quiver as a security professional. So try and learn Septet principles and as advanced as your capability when you have the option. But fundamentally, the traditional security design measures need to be addressed first. So use a very good security design professional in your process, whether it's internal, whether it's hired, whether it's part of the construction team already, and make sure that they give the voice to security throughout the whole process. Security operations and management tends to be brought into construction projects, retrofits late in the game. And that's actually when they have the very least amount of impact. It really should be a discussion at the very beginning of the project. So if you're a senior manager within your organization, make sure you're aware of what new real estate is being considered or constructed, and make sure you have a representative, whether internal or external, in those discussions as early as possible, and just make sure that they're supporting those security operations. When you find out and it's a bit late in the process, do what you can to get as much input as possible, because that ends up paying for itself. The cost to move walls and doors in the CAD blueprint environment is very inexpensive compared to doing that in the real world after it's been constructed.
Absolutely. Now, from yourself, what can we expect to see? What can we look forward to from you in the future?
Oh, thank you. Well, I'm a horrible salesperson, so I don't know if you'll necessarily see much from me unless you're working directly with us. But feel free to connect with me on LinkedIn, or go through our website and try and learn more. It's again Safeguards Consulting, safeguardsconsulting.com. I'm Mark Schreiber. It's pretty easy to find on LinkedIn. But we will have some information shared, like for example, this year in 2020, what a crazy year that just passed us. We put out a paper on COVID-19 facility security related to the hardening. We call this infectious disease hardening, on how we can actually support, pandemic restrictions, pandemic awareness, and supporting natural surveillance within our facilities to support physical distancing. That's downloadable. So we'll probably start continuing to support that in 2021 as new facilities might be designed, which are more pandemic sensitive, we'll say, whether it's COVID-19 or any future epidemic or pandemic. We're actually supporting Septet right now within ASIS as I'm the lead volunteer for that on a new ISO standard, which is a security management standard specifically identifying the application of Septet to your organization. So we're very excited about that. That should be breaking news in 2021. And several webinars, conference support initiatives, I'm sure you'll see with my name attached or my company's name attached moving forward. That's the items I can think off the top of my head. But again, I'm sure there's more.
Awesome. Now, in closing, is there a message that you'd like to share with the Healthcare Security Cast community?
I first off would like to thank everyone for their extremely hard and difficult work over 2020. We all knew that there was the potential for a pandemic. Some of us have even experienced epidemics before. But what we've had to do, I shouldn't say what the healthcare security community has had to do over this past year, I think was way above and beyond anyone's job, title, role, expectation. And I've not seen one case where a healthcare security professional hasn't risen to the occasion. So as a citizen, I really want to thank you. As a security professional, I want to doubly thank you because I knew how easy it would have been to just kind of step back when the call came out. So I appreciate all the hard work, and that extends not just to the individuals, but all the families, because everyone's family has suffered, because of the work that had to be done during this time frame. So I think everyone appreciates it, and I hope everyone continues to appreciate in the coming future all of the efforts that were made during this pandemic. And I hope it will cement, a level of respect and appreciation for security professionals moving forward.
All right. Well, thank you very much. For everyone who's not connected to Mark, connect with him on LinkedIn, check out his website. And again, thank you very much for your time. I appreciate it. And I'm glad we were able to have this conversation.
Thank you very much. Have a great year.
And this concludes another episode of the Healthcare Security Cast. Thank you for tuning in. Join the Healthcare Security Cast community. To join, text START to 647-372-2042. Again, that's text START to 647-372-2042. Follow the Healthcare Security Cast on LinkedIn and Facebook, and join the Healthcare Security Cast community groups on both platforms as well. Follow us on Twitter, Instagram, and TikTok. And of course, you can always connect with me on social media. I'm the only Brian, B-R-I-N-E, Hamilton, on any of these platforms. For any of these links, visit my website, Brian, B-R-I-N-E, Hamilton.com. That's brianhamilton.com. Thanks again for joining us. Tune in again next week when we have a new guest and a new topic. Until then, Take care and stay safe.